So recognizing these early symptoms, as we said, short-term memory loss is quite common, but then it's all these other things: abstract thought, calculation, visuospatial skills, that's sort of like getting lost in a familiar environment, concentration, speech language problems. And then this sort of like big group of planning and judgment, concept formation, working memory, inhibition. These are all sort of what we call our executive function or our thinking ability. So sort of suffice to say, is really all of these things together. One of the things which is particularly worrisome, if you notice it in somebody, is somebody who will repeat something that they've already told you unknowingly, but also somebody who doesn't remember that or doesn't remember details of a recent event. And when you try to jog their mind and give them a sort of like a few cues, they still can't remember it. So it's like just completely gone. And that's a very significant early finding. Now, this slide is not for the intention of being read. It's really just to say that the other problem is not only are the symptoms difficult to elucidate because they're just sort of like, our thinking ability, but there are also numerous other conditions that present with these same symptoms. So when somebody does sort of like, sit down in front of their doctor or complain to their partner or whatever, that they think there's something wrong with their thinking ability, there's so many different things that can cause this. And so one of the reasons why it's really important to get an early diagnosis is many of the conditions here are actually reversible. And it's very important, if you do have a reversible condition, to get that diagnosed accurately and to have it treated as soon as possible. And then obviously if it is Alzheimer's or another progressive disease, then it can be treated appropriately.